Welcome to today's webinar on physical activity for the Bolder Healthier Community Champions. Today we're going to be talking to you about physical activity and about how you can help support everyone in our city to become more active every day and some of the benefits that come with physical activity. I'm Dr. Justin Varney. I'm the Director of Public Health for Birmingham City Council, and I'll be presenting today's webinar for you. So first of all, I thought it was useful for us to just talk about what's the difference between physical activity and exercise. These are terms we use every day, but actually trying to help everyone understand what we're going to be talking about and how we use this language is really important. So physical activity is defined as any bodily movement that's produced by the skeletal muscles. They're the muscles that connect between our bones in our body, and they require energy expenditure. So really think about physical activities, anything that requires you to move around, whether that's reaching for the sky, touching your toes, twisting, walking, dancing, all of that's physical activity. Exercise is a form of physical activity that's planned, it's structured, it's often repetitive, and it usually has a purpose or a form. So sport, playing football, is a form of exercise, but it's also a form of physical activity. Dance can be exercise, but it can also be unstructured, and it can be dancing around the living room with no particular form or repetition or structure at all. So exercise is a subset of physical activity. Physical inactivity is a term that you often hear us talk about as well. Physical inactivity means when someone's doing less than 30 minutes a week of moderate intensity physical activity. And when we talk about moderate activity versus vigorous activity, moderate physical activity is the kind where you feel a little bit warm, a little bit short of breath, a little bit sweaty, but you can still have a conversation and you don't feel like you're going to get exhausted. Vigorous physical activity is like when you're running or playing football or working out at the gym. You're really getting that sweat on, and it would be hard to have a conversation while you're being that active. But what we talk about when we talk about people who are physically inactive, they're not even achieving 30 minutes of that moderate, feeling a little bit warm, a little bit breathy type of activity in a week. Physical activity comes in many forms. It can be dancing, it can be active play with children, it can be organised sport or the kickabout in the park. It can also be what's called active travel, and that's when we're walking or we're cycling to get somewhere. And that might be all the way when we're going to school or to work or to do the shopping, or it could be part of the way where we're walking to a bus stop and then using public transport. That's what active travel means. But we also cycle and walk for fun. And there are many places around Birmingham that you can go and have a wonderful walk or a cycle with friends and family and just enjoy the beautiful things you can see across our city. So how much physical activity do we need? Well, as adults, the recommendation is that we achieve at least 150 minutes of moderate physical activity every week, or 75 minutes of vigorous physical activity. You can do that activity in any amount. It doesn't have to be in blocks of 15 minutes or 30 minutes. Every minute counts towards it. In addition to that aerobic activity, that activity that makes us breathe a little bit faster, feel a little bit warmer, we also need to be doing strength building activity at least twice a week. That can be working out with weights at the gym. It could be doing things like yoga, using your body weight to do press ups, for example, or simply carrying heavy shopping bags. All of that helps build our muscles and build our bones as well. As we get older, it's really important we invest a bit of time every week in balance. As we get older, it can be a bit harder and we can be more risk of falling. So doing activities that support balance, whether that's dancing, Tai Chi, playing games like bowls, can really help reduce the risk of having a fall as you get older. And finally, for all of us, it's really important to break up the amount of time we spend sitting. The reality of society is that too many of us are chained to our computers or sat watching TV for too long. So breaking up that time and trying to avoid sitting for more than an hour in one place can really have an impact on your health and your well-being. And every move counts. One of the big changes in the evidence base, the research around physical activity over the last 10 years, has been the recognition that actually every movement matters and every minute counts towards your 150-minute goal. Now, if you do more than 150 minutes a week, brilliant. We know that the benefits of being physically active just grow and grow and grow. But over about 300 minutes, you don't see as much gain. So the reason that the chief medical officers have recommended 150 minutes as the target for all of us as adults is that that's the kind of best balance between how much realistically people can fit into their life, at 20 minutes of activity every day, versus how much health benefit they get. More is better, but some is better than none. And at every point, particularly once you get above that 30 minutes of moderate activity a week, you start to really see benefits for your health and your well-being. When we look at inactivity across Birmingham and the levels of physical activity, we've got a bit of a way to go. The dark blue line represents the proportion of adults that aren't achieving 30 minutes a week of physical activity. And you can see that's over 30% of adults. And that stayed pretty stuck for the last few years. So we can't blame it all on the pandemic, I'm afraid. The proportion of adults that are achieving at least 150 minutes has fallen slightly over the last 5 or 6 years and is now only about 55%. And the proportion that in the middle sits around 12 to 13%, and that's staying pretty stable. So you can see there's quite a lot that we can do, particularly if we can get those 30% of adults that aren't even doing 30 minutes a week over that 30 minutes a week threshold. We would have a really big impact to the health of everyone across the city. So why does it matter? Well, physical inactivity is one of the top 3 causes of people dying younger than they should. It sits right up there with smoking and with an unhealthy diet, and up there with things like alcohol and substance misuse as well. The maths have been calculated that being inactive is costing the NHS every year over £900 million. Every single year, that's how much the NHS is spending on diseases that if people were a bit more active every day, we wouldn't have to treat, and people that wouldn't be getting ill or sick in that way. It costs the wider economy of the UK over £7 billion a year, and that's through losses because of sickness absence, because of those health conditions, and people unable to work because of conditions that wouldn't be happening if they were physically active. There are over 40 different conditions that can be improved by being physically active every day. Being active not only reduces your chance of developing the condition, it also means if you've got a disease like diabetes or high blood pressure, that being active every day can reduce your symptoms and can reduce your need for medication. The benefits of physical activity are not just about physical health, they're also about mental health. We know from the research evidence that people that are physically active every day have lower levels of depression, of anxiety. They've got improved self-esteem. And there's even evidence that if you work with older adults who've already got some elements of dementia and cognitive impairment, and you work with them to support them to be physically active every day, particularly with muscle strengthening activity, that those symptoms of cognitive impairment improve. Doesn't unfortunately cure conditions like dementia, but it can significantly improve the symptoms and give people with dementia a much better quality of life. There are also other impacts of physical activity, and we know that particularly in children and young adults who are active every day, that they tend to have better social skills. They do better when it comes to employment and when it comes to education. And that often connects back with that concept of being physically active makes us stand a little bit taller, feel a little bit better about ourselves. And that doesn't matter how you get active. It's being active every day that makes a difference. These are just some of the benefits of physical activity, and you'll get the slide pack when you watch this webinar, so you can look at the links and read for yourself the evidence base that shows these really big impacts of being active every day can have. Reducing your risk of type 2 diabetes by over 40%, reducing the risk of hip fractures by over 68%. These are all real numbers coming from medical research, and they show that if physical activity was a pill, we'd all be taking it every day. There are lots and lots of different ways of being physically active, lots of different sports, activities from dance, walking, cycling, running. being physically active is about finding what works for you. There is no one size fits all. There is no one perfect form of physical activity that's going to work for everyone. So it's about trying what works in your life and in the lives of your friends and your family to help them get physically active. Taking small changes can really make a difference. Thinking about, can you take one flight of stairs before you get the lift? Can you take the stairs rather than the escalator at the station? Can you walk to school or to be part of a school walking club rather than taking the kids to school in a car? How many of us have driven our children to school and you spend it with one eye on the road and one eye looking in the rear view mirror to talk to your children and try and engage them while navigating rush hour traffic? Not exactly quality parenting time. But you know, when you walk your kids to school or you go out for a walk with them at the weekend, they're pointing at things, they're asking questions, they're curious, they're engaged, and that is quality parenting time. Thinking about how can you take a break at work and just get away from your desk, even if it's to walk around the corner to buy your lunch. That bit of physical activity can really break up, particularly if you're having a stressful day, and it can help build that activity into your day as part of your daily routine. And if you're at home watching TV, just getting up and moving around, having a bit of a star jump or a bit of a dance in the advert breaks so that you break up that sitting activity can be a really good way of just fitting it in, just getting a little burst in. Every minute matters, every move counts. If you're that way inclined, go and join a class. Sometimes we all need a little bit of extra support, whether that's with a personal trainer or being with a group of friends, taking part in sport or one of the community challenges. And although often it feels like people are being a bit vain when they post on social media that they're going to the gym or they're taking part in physical activity, the evidence shows that actually by making that public statement, that public commitment, you're much more likely to keep going and keep engaging with the physical activity. So to some extent, join the club, get on board with whatever's going to work for you, and recognize that what works for you might not work from someone else, and it might not work for you every day of the week. So mixing up a bit and trying different things, particularly as you get older, can be a really good way of keeping active. So how can we champion it? What can we do when it comes to being a bolder, healthier champion in our communities? Well, one of the ideas we can do is talking about making every contact count. Thinking about how can we integrate a conversation about physical activity and talk to the people that we're in contact with and say, did you know this? Did you know that physical activity was one of the best drugs there is when it comes to reducing conditions like dementia or diabetes? Did you know that it doesn't matter how much activity you do in a burst? You don't have to go to the gym. Jumping up and down on the spot and doing it 10 times a day for 5 minutes each time all counts. It doesn't matter how much you do or how you do it. As long as you're getting that warm feeling and that little bit breathy feeling, that's counting towards your moderate physical activity. So making those conversations matter and making those contacts count, a really important part of your role as bolder, healthy champions. We're doing these webinars to give you a bit more confidence and give you an awareness about the impact of what being more active every day can do, as well as understanding a bit of the local picture. But these are tools for you to go out and have conversations. Part of signing up to being a bolder, healthier champion in your community is taking on that responsibility, not just to listen to these webinars for you, but to take it out into your community and make a difference for the people that you care about. Whether that's your friends, your family, the people at temple or mosque, the people at your local church or in your local football club, however you connect to people, having the conversation and spreading the information is part of what you've signed up to and part of what you're part of in the Bolder Healthier programme. There's plenty of support for physical activity in Birmingham. If you live in Birmingham and you pay council tax in Birmingham, you can access a whole load of free support through the local leisure centre. And you can sign up through the web link that we put in the slide pack for you. There are a load of other resources. There are walking groups, whether you're into the heritage and the history of the city, there are walking groups that look at that. Whether you want to learn about the cultural history of the city, there are walking groups for that. There are even Pokemon catching groups if you want to join up with those. Whatever it takes, find something that works for you. And don't be afraid to try different things and try different things until you find something that works for you. Physical activity is something that we all need to do every day. And by nature, we like to have variety in our lives. So it might be doing dance on a Monday and going jogging on a Tuesday, and taking the kids out for a walk on a Wednesday, and going out for a dance with friends on a Thursday. It doesn't matter. There are all these different ways to build it into your life. So try different things until you find one that works with you, and encourage your friends, your family, the communities you're in to be curious about what's out there. There are other resources available. There are more detailed webinars that we have on the Healthy Brum YouTube channel that go into quite a lot of detail around the role of physical activity and mental health, coronary heart disease, and other health factors. There's also a suite of posters around sport and physical activity. So if you want to find out what the health benefits are of squash versus rugby, we've got some posters that you can have a look at, but you can also pin them up on a local notice board. You can share them with your friends. There's some really interesting little facts and figures in there that you might find fun for a game of Trivial Pursuit. So I hope that's been helpful. Today's webinar is about giving you the information as champions. It's about giving you a bit of confidence to have the conversation with the people you care about, and about sharing this information in your communities. The slide pack has a lot of links to help support you and give you more information. And the team are here to support you. So if you have further questions you want to ask us, do pop them in through the Bolder Healthier Champion email, and we'll be happy to help. We're really grateful for the time that you've given today listening to this webinar, and I'm really grateful for your energy and your passion to make a difference in our city. There is a lot that we can do to improve the health and well-being of the people that live in Birmingham, and you're a really important part of making a difference. So thank you for your time, and I hope you will be inspired to go out and get a little bit more active today.